6:43 minutes of the hour of 9. A very good morning, a wonderful Wednesday, and we've got a wonderful topic. In the radio industry, I've always been taught that try to make it simple when, giving out information. So anybody and everybody from all age levels, they can actually grasp and comprehend. And today is a similar topic because we're going to be joined by specialist orthopedic surgeon. In simple words, you can say herani, parishani, you can say kahani. When you bring all these things together, we are talking about knee pain. And so many right now will relate to this. And for that, very happy to welcome Dr. Vikas Sonale, driving down all the way from Sharjah, that is NMC Hospital. So without further ado, Dr. Vikas, what a pleasure to have you with us right here on Daybreak on Talk 100.3. It's part of Fun Asia Network, but not so much fun, Dr. Vikas, when it comes to knee pain, right?
Yes, thank you. Thank you for inviting me in the radio talk. Yeah, it will be a fun for me.
Yes, when it comes to making life easy for people who are actually going through it. So let's start, doctor. When it comes to knee pain, it seems to be a very common complaint these days. But how widespread is knee pain among people? Particularly, we want to know those who are living in UAE, especially women, and those who are living in UAE, especially women, and not to forget men too.
Thank you for asking this question. I think it's a very important question nowadays. Everybody feels knee pain.
Correct.
You are right to notice it is a quite common complaint globally, and it is a significant health concern in UAE as well. In fact, in recent research, study confirmed that knee pain, especially due to conditions like osteoarthritis, meniscus injury, have a significant healthcare and economic burden in UAE.
Doctor, now let's understand one thing, right? To help our listeners and ourselves as well, if you can please explain the common causes of knee pain that you probably have seen in over your 18 years of practice in the industry. What has it been and why do we suffer from knee pain? Is it only because of overweight?
No, I think I can give a detailed answer about
please.
It is a great question. While knee pain is quite common in UAE, reason being different knee pain in different populations. In my practice, I see there are three main categories of knee pain. There is acute injury, some is like chronic overuse injury, and third one is arthritis like knee pain. Acute injury means someone who comes within 3 weeks of injury is probably because of a fracture, because of the ligament injury. Ligaments like ACL injury, medial collateral injury, and some kind of a meniscus injury.
Within 3 weeks of the injury.
Within 3 weeks of injury is called as acute injury.
Okay.
Some are like chronic injury. When it comes like more than 3 to 4 weeks after 4 weeks of injury and comes to the clinic, they call it a chronic injury. Or sometimes it is a wear and tear kind of
So that can happen in your younger ages, right? Wear and tear.
Or sportsmen maybe.
Right. But when you come of age, a lot of, like I know my parents and my in-laws all often complain of knee pain injury. What is that?
Yeah, is called as a chronic knee pain is most probably because of arthritis knee pain. There are different grading of arthritis like early arthritis, moderate arthritis, then severe arthritis.
Dr. Vikas, still uncurable?
Yeah, it is curable.
It is curable.
If you come early to the doctor and diagnose early, I think can be a curable thing.
But what leads to there? How we can actually prolong this? Like you have just mentioned the figures in UAE, how we can help prolong this or perhaps avoid it if possible?
I think people used to sit in the floor or squat or take stairs quite long.
Oh, yes.
So
All gone.
The knee pain or over a year of prolonged period, the degeneration can start and start this knee arthritis.
Correct. Now, doctor, there is a huge thing, right? When it comes to knee pain and knee discomfort, what happens is we tend to ignore. We ignore the signs, we ignore everything, and we keep it on a later stage. Now, when, according to you, should someone seek medical advice that will prove beneficial? And what happens if I don't get that advice at the right time?
It might be someone experience knee pain first time, or someone have knee pain since long time. It is confusing for them to when to get a consult to the doctor. I can ease you that questions for you. I think I'll suggest some questions to be asked to yourself when it comes to the knee pain. If
Okay.
you are coming like, is this pain allow you to do your job? Means, is it stopping you putting weight on your leg, or you're limping badly, or it is affecting daily walk, or if you are not able to do your job, then I think this is the time you can
Sitting,
consult to.
standing, at times people sit on the floor
Yes.
and then they get
Get
up
up.
as well. Getting up is difficult. You
Yeah.
need some support here.
Support, yes.
Okay, so in that case.
In that case, second question, you can ask to yourself whether knee is looking angry.
Angry?
Yes, is angry means there are signs and symptoms in the knee. If the knee is swollen and red, in case of an after trauma, then it suspected a ligament injury or a fracture. If it is angry in the sense, if it is knee is red and swollen, not because of any trauma, we suspect any inflammation or any infection in the knee joint.
So this can be any angry old knee or angry young knee.
It can be any angry in young also and in old also.
Okay.
Means probably if it is angry in the case of young, probably it is a ligament injury or any fractures. If it is old, it can be arthritis or kind of cellulitis, like we say in the.
And does the intensity increase, or does it vary from different age groups? Maybe obviously what a teenager would experience would be very different from what an older person would experience, right? But all of this might start at a very early age, the signs that we have not noticed. So what are the signs, doctor, that I must notice? Say I do not know something is wrong with my knee, but are there any signs that we must look out for in maintaining a good knee?
Or perhaps early stage, doctor. So, like you said, if you reach out to the doctor early stages with these symptoms we are about to know from you, the help is going to be, and I think the cure is going to be easier.
Yes. So according to you, if my knee, say, today has, I've jerked my knee, right? I've banged my knee against something and it's hurting me. Now, but sometimes there are prolonged pain in the knees, right? There are prolonged pain in the knee, which we do not understand. And that's why when you were talking to us about ignoring discomfort in early stages, what are those discomfort that we need to be talking about? And when you are explaining it to someone, how will you explain that, yes, this is a knee-related problem?
Yeah, pain around knee becoming increasingly common among young patients. Many of my patients in 30s or 40s, demanding like desk job, sitting
Ooh,
at
okay.
sitting 8 to 10 hours of day. In weekend, what they do is suddenly they go for high intensity sports, running and jogging, and do something or gymming. Then suddenly what their knees adapted is earlier is a weak knee, little bit of muscles are weak. If you go suddenly for any sudden activity, that will
The impact would
be
yeah.
more on the knee.
So,
and
doctor, we are sitting for 4 hours on this seat. Is that okay? Because you said
I think, ma'am, if you say like sitting in the 4 hours, I suggest is take a break in between, like 1 hour, 2 hours, and go around
okay.
and walk little,
Stairs
stretch,
up and down.
yeah,
and
stretch little bit, and you warm
See,
up
we
your
have
body.
very less time, listeners. Only 8 minutes to go. So 0586861003 if you want to just drop in with a quick question to Dr. Vikas. Now, the next one we want to know.
Well, are there lifestyle habits, doctor, or daily activities that say may increase the risk of developing any knee problems?
Absolutely. Most people think knee problem come from only one big event, like accident. But in reality, only few people have this kind of reason. But most of the time, it is a daily habit which is creating a problem. I'll tell my patient that your knees are mechanical device. How you treat them every single day determines how long that lasts.
Sure. And usually these patients must be more of women, doctor, because we have heard that women knees are weaker as compared to men. They cannot take impact as much as men can. Is that a myth?
little bit you can say.
Okay.
Women are more prone about the knee arthritis
Because of the
than
heels
heel.
and
heel, because of heel, and the posture of the foot is like an
Yeah.
equinus, and then goes more stresses on the knees. So that's why I think women feel more
standards
kind
and
of,
heels always high.
yeah. So avoid. I think I suggest to avoid the high heel
Well,
routinely.
Routinely, okay. So,
Routinely.
doctor, what preventive measures or exercise, according to you, you would recommend for people, say, to maintain very healthy heels, and heels and knees both?
To maintain the knee, I think I go from the basic one. So we start from the patient comes in the clinic. We suggest that eat good food.
What is good food, doctor?
So healthy fruits like what you get in the healthy fruits available in the market, some good proteins, then the food which having a good amount of calcium and vitamin D. So calcium means like green vegetables, milk, yogurts,
Okay.
then meat also you can eat on and off, and fish is a good source of vitamins. So I think tuna fish and all these things you can
But for a
take
vegetarian who doesn't have meat, what do they do?
ma'am, I suggest is you can take a tofu or paneer or milk or yogurt, that is, and in Indian I think we can call it ragi, that is rich source of calcium also.
Doctor, they
Right.
say that, the lubricant is basically at times starts, forgive me because I'm not from the industry, so might not use the proper terminology, but there is lubricants between the bones when it comes to your knee, and that with time and not good food habits gets reduced. So maybe superfoods, I don't know if flax seeds or things like that regularly included in your diet, would that help as well, or not really? It's, an amalgamation of a lot of food choices together.
Yes, definitely. It will help a lot for building your knee fluid. Like knee fluid, what we call in medical terminology is synovial fluid. Is
Okay.
like a lubricant in like what we have in car or bike. We have like oil. So that it is like a lubricant.
Good example, yes.
It is
So,
like.
we got a question, doctor, that is coming from Ajmal. Now, he says, I'm a non-regular sports person, but I also play football at times, okay? So, sometimes, what about sudden, shooting pain after a football season? It does happen. I'm a non-regular sports person. So, how do you avoid it?
I think, like I said, if somebody has a sedentary lifestyle and suddenly goes for a sudden exercise, having knee pain only quite often, then it's quite natural, normal. But if he is persisting regular knee pain, then there might be some ligament sprain or injury in that scenario. So I ask him to consult a doctor, get examined knees, and
What about shin pain? That's what he's added onto the question. He says shin pain only.
if he is having a shin pain, probably low calcium or low vitamin D, that can add to the shin pain. Or sometimes the footwear also a major issue of having
Yes. Well said,
a
doctor.
shin pain. So I suggest check your footwears, those having medial arch support, good sole, so that when you jump or do high activity on the concrete or somewhere, so that will absorb your shock.
But if you're playing football, you are, you are supposed to be wearing spike shoes only, which is any which ways quite difficult to kind of balance. If you've ever worn spike shoes, it's really, really hard. It's painful as well. And you've got to kind of make that run. Obviously, and if he's playing football, then this would be another cause of an issue that he should kind of stop for a bit. Is that an...
Take a break for a while and let your body to regenerate. And
With good food choices.
Good food choices.
Now, doctor, a lovely husband of a wife wants to know that my wife is again having the calf pain, he mentions, when she goes to bed, and he has done a very dangerous thing of mentioning her age. She's in her 60s.
In 60s, I think there can be a. I like to examine for I would like to have a detailed history, but what you said on the behalf, I think she might have some kind of early early knee degeneration. So
Right.
we suggest is to get an X-ray done.
Okay, the
And
next one is, Doctor, is weight gain a cause of knee pain? This is coming in from Akila. She says pain while taking steps and while getting up from floor. Is that an issue?
Yes, sure.
Very
So
common.
getting up from the floor or the knee stair while pain is while knee staircase climbing, that is quite common in our scenario. So what I suggest is so whenever you sit, so take a sofa or chair to sit. Avoid sitting on the floor or squatting, or wherever possible, then take a lift.
Then how
We-
to, get better, Dr. Vikas? This is to avoid further damage.
So I suggest is to start some exercises like
Okay.
knee strengthening exercises. We have like quadricep exercises. We have hamstring strengthening exercises. So that can help to build muscle around knees, and take some good food also. And if at all if she had a pain, then apply some local ice application that will help you a lot.
What about these heat therapy or these ointments that come? Do they prove to be any better, or it's always advisable?
Definitely, in initial stage, I can recommend to apply some local ointment or analgesic ointment, and apply some heat so that blood flow will increase in the local areas. So that will give some sense of relief to the knee pain.
Dr. Vikas, would you recommend knee replacement? And is that the last option? Because very painful, but quite successful at times if you have the help of right doctor.
Yes, sure. I like to answer, I think, in a little bit of in detail. So, knee arthritis is quite common. So, if I say somebody's come to the early arthritis, we can manage with a conservative line of treatment. Conservative means we give some tablets, some analgesic, some anti-inflammatory, some ointment, and reduce the knee pain. In case of a moderate arthritis, we have a treatment option like injection therapy. So we can give some kind of local PRP or steroid injection in the knee joint, so that pain will get reduced. And associated with that, I can suggest some knee exercise also. In last stage of arthritis, when a patient is not able to walk or is completely bedridden, in that scenario, definitely recommend a knee replacement. There are 2-3 kinds of knee replacement.
It's quite a lengthy topic and we are running out quickly. A doctor wanted to know that it's better to climb stairs or use them as stepping down. Which is better for our knees, or none of them?
We cannot avoid completely.
If you have a
climbing,
choice of
and
elevators, so
if you have a choice of elevator, definitely you can use the elevator when you have knee pain. If you don't have knee pain, climbing is much more easier rather than getting down. Getting down from the staircase,
Impact on the knees.
Yeah, impact on the knees is much more higher than climbing stairs.
Right. Doctor, you also had a very important question. I know we're running out of time, but diagnosis and the treatment. If you can quickly sum this up, how do we diagnose it, and what are the treatments for a knee pain or a knee surgery?
Yeah, diagnosis and treatment is a very huge topic. In sense of diagnosis, we take first, once patient comes, we do examine the patients, take a history, debrief history. So on that note, we can have some 2-3 differential diagnoses. On that basis, we advise the patient like X-rays, MRI scan, CT scan, some kind of ultrasound examination. And these are like non-invasive kind of investigation. Like sometimes whenever needed, like we are suspecting like infection or something, then we ask for blood lab or knee aspiration. We send for the test, blood
Dr.
test.
Vikas, now our listeners are investigating about you. They want to know details. Where do you, sit, and what are the days that they can approach you?
I am Dr. Vikas Sonale, working in NMC Maysaloon Center,
Sharjah.
Sharjah. I am a specialist orthopedician. You can contact me on all days.
All days?
Yes.
No holiday, doctor?
Yeah, weekly one holiday is
Oh,
there.
thank God.
Weekly one holiday is there.
Well, thank you, Doctor, once again for taking time out, coming to our studios, having such a lovely chat with us. We wish we could have continued this longer.
That's
but
right.
Thank you.
And
Thank you.
what is that one day, doctor? So patients don't trouble you on that day?
Wednesday.
Wednesday. Oh, wonderful Wednesday. It's his off, but he actually came down for our lovely listeners. What a pleasure. Thank you so much, Dr. Vikas.
Thank you.
You know, it's interesting that it was his very first time on the radio, and I told him that he's going to do so good. And look at the amount of questions that have come in. But please, everybody, let's, put this as an effort in our mind first to take care of our knees, because knee replacement surgery is something you don't want to think about. But yes, like Dr. Vikas did mention, that if we have no option, then one has to go for it. Where are we going? Into the final hour of Daybreak right here on Talk 100.3, part of One Asia Network. And do check out our Instagram page. That's where you catch the highlights of this interview on Talk 100.3 UAE.